Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Point 3 Exercises to improve erectile dysfunction symptoms. Erectile dysfunction, ED, occurs when a person loses the ability to maintain an erection. The muscles in the area that work to maintain an erection can lose strength and tone over time, contributing to ED. However, the most common causes of ED are conditions that affect the function of the cardiovascular system, including obesity and high blood pressure, hypertension. /r/n/r/n Exercise can help improve ED by building muscle tone and strength and improving cardiovascular function. In cases in which ED is caused by something else, exercise may not be beneficial. /r/n/r/n Lorenzo Getty ImagesrnrnrnVerywell Health acknowledges thatsex and genderare related concepts, but they are not the same. To reflect our sources accurately, this article uses terms like female, male, woman, and man as the sources use them. /r/n/r/n Kegel exercises target the pelvic floor muscles, which play a role in the maintenance of blood flow to the penis to sustain an erection. You can do 2 types of pelvic floor activation exercises to improve muscle tone in the area and, thus, symptoms of erectile dysfunction. /r/n/r/n Learning to activate pelvic floor muscles includes /r/n/r/n It's essential to activate the right muscles. You will know you're doing it correctly if you can feel muscles at the bottom of the pelvis contract. /r/n/r/n To perform sitting pelvic floor activation, you will. /r/n/r/n You can also perform these exercises while standing straight with your arms by your sides and your feet as wide as your hips. On the exhale, activate the muscles for 3 seconds, on the inhale, release them for 3 seconds. /r/n/r/n When you're just starting, you should gauge your body to see how well you handle the exercise and ease into it. Once you can perform Kegels 3 times daily, add in other exercises that benefit ED. /r/n/r/n Aerobic exercises can significantly improve ED because they improve cardiovascular health, the heart and blood vessels. /r/n/r/n Types of aerobic exercises that you can include in your routine are /r/n/r/n Typically, any type of aerobic exercise will help, but moderate to higher intensity is suggested to have a more significant impact. /r/n/r/n Yoga is another exercise that can help improve the symptoms of ED by improving circulation and blood flow to the groin area. An older study from 2010 has also shown that yoga can improve many other parameters of sexual function, including performance, ejaculatory control, and orgasm. /r/n/r/n 2 types of yoga that support sexual function are /r/n/r/n Choosing the proper exercise is a personal decision, only you can decide which type will be best for you. You'll have to consider the enjoyment you'll get from the exercise, which will play into how well you stick to a routine, as well as your current health and fitness level. /r/n/r/n For example, aerobic exercises are great for circulation, but running for long periods isn't always recommended for people with specific lung diseases and can be harmful for those with disorders that affect their knee joints. /r/n/r/n By considering your capabilities, health level, and desired activity, you can choose the exercise that offers the most benefit for you. /r/n/r/n People who want to use exercise as an added support in treating their ED should engage in 40 minutes of moderate to high intensity exercise 4 times per week. /r/n/r/n While it is recommended to spend 40 minutes 4 times per week doing moderate to high intensity exercise, it's essential to ease your body into a new routine if you haven't exercised in a long time. This will help you avoid injury and burnout and get your muscles used to more physical activity without putting too much stress on the body. /r/n/r/n Eating a healthy diet full of whole foods can help prevent ED because the body needs various nutrients to run at its best. Multiple parameters of health that can play a role in ED can be improved through diet, such as /r/n/r/n. There are many ways you can reclaim your sex life without medication, but various drugs are available, among other therapies, that you can try if other avenues don't work. /r/n/r/n. Some medications include /r/n/r/n. Other treatments may involve /r/n/r/n can be challenging to cope with, so it's essential that people who have ED practice positive coping mechanisms, including /r/n/r/n before starting an exercise program to improve ED. Speak to your healthcare provider. They will be able to provide a detailed account of your current state of health, what your body can currently handle, and what exercises would be the most beneficial for you. Follow up with your provider and consider other treatments available for ED. /r/n/r/n Erectile dysfunction can be challenging to cope with, but there are many therapy options available, including exercise. By performing various exercises that help to strengthen the pelvic muscles, increase cardiovascular health, and improve overall health, you can experience relief. /r/n/r/n Talking to your partner about your ED, seeking counselling, and trying medications are all other viable options to use alongside exercise to address your ED. Before starting any new treatment or exercise regimen, you should speak to your healthcare provider to address any underlying causes. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.